As Karen mentioned, Rachel can't make it today. Some of you might know Rachel. She's been to the previous 5 education days, as have I, as have a number of people in this room, sort of regular attendees at these things. Rachel Murray is our chair of ANZFAC, the Australian New Zealand Fontan Advisory Committee. We're having a bit of a think about the name of that committee now that we're no longer attached and come under the MCRI and the Fontan Registry, but that was how we started. We began as an organisation dedicated to advising the Fontan Registry on the kinds of research that might be useful and acting as a bit of a sounding board. I don't know if do we have some slides for this one? Hey, terrific. Thank you to the registry for hosting us. Some of you may have seen our paraphernalia outside on the Heart Kids table. ANZFAC is now a subcommittee of Heart Kids, and I appreciate Lisa making mention of this earlier today. But I might just get the members of ANZFAC to stand up again, as you did this morning, just so we can identify you. We've got a number of people in the audience and today who are part of either ANZFAC or our auxiliary. Thanks, guys. And you should feel free to go up to those guys and ask them anything about ANZFAC's activities or how you can be involved. The point of this day, of the committee was really being born out of the education days as a way to keep the conversation going around the community of people living with Fontan circulation or with a connection to people who are living with the Fontan circulation. So that's what ANZFAC is there to do. It's to keep the conversation going, to keep people in touch with each other and to build that sense of community for the people in this room and around the country and New Zealand. So these are some of our current projects, and I'll talk a bit more about some of them, but going through them in brief. We've got the Fontan Carers Groups. Those are carers groups and meetups that we are hosting around the country, and they're being rolled out in the next little while under the kind of the guidance of Heart Kids in the same way that they run their community conversations. We've got a Fontan mentor program which will aim to connect people living with the Fontan circulation who've already been through some of the challenges that we know people with the Fontan circulation will face with people who are still experiencing or yet to encounter those challenges, and that's being led by Gemma, who is one of our committee members at the back there. Q&As, which are opportunities for us to quiz members of the Fontan community, who might be people living with the Fontan circulation or might be clinicians who are involved in Fontan practice, and have those questions and answers recorded and then broadcast on Facebook. So you should jump onto ANZFAC's Facebook page and give that a like and a follow. Fontan personal stories are similar in that we are trying to publicise some of the really great stories that we hear around the Fontan community that you're not necessarily aware of unless you come to a day like this, or you happen to see something on Facebook. So we want to make those opportunities to see things on Facebook a bit more prevalent and prolific. Advocacy, and I'll talk about that a bit more in a bit more detail in a moment, but what we can do as a community to advocate to improve the lives of people with a Fontan circulation. Footy for Fontan, which is a fundraiser for the Fontan Registry, which has been run by ANZFAC for the last couple of years under Jonathan Mackley's guidance this year. I would encourage you, if you're a footy fan at all, we're at the end of the season now, but look out. So not for sign up for next year. That's right. So we'll be kicking off the start of footy season next year again, no doubt. And Creative Heart, which is an art therapy project, which we are just in the process of launching, and that you'll hear a little bit more about later this week. So that's some of what's coming up. So some of those in a little bit more detail. The Fontan Carers Groups events are due to roll out in the next few months, I guess, but you'll hear about them in the next few weeks in Brisbane, Melbourne and Perth, and details will be up on our Facebook. After that, we'll be rolling, and depending on how those sessions go, we'll be rolling out carers groups here in Adelaide, in Sydney, in Hobart, in Auckland and in Wellington. The Q&As, the Q&As that we've got coming, we already have a number of Q&As up on our Facebook, and I would really encourage you to go and have a look at them. Lou did one of those Q&As, and that's up on YouTube, and you can get to it through our Facebook at the moment, and it's really, you know, if you want to see that conversation that Lou did about exercise and a whole bunch of other really interesting and important experiences that Lou has been through, she's shared those very openly and frankly on her Q&A, and I would encourage you to give that a look. But there's a couple of others that are coming up which are really exciting as well. Obviously, we've got Dr. Frank Mascara talking about neuropsychology, Dr. Kim Matthews on pregnancy in the Fontan, a little bit building on adding to Dominica's talk today, and Dr. Rachel Cordina is also giving us a Q&A on exercise in the Fontan in the next few months, so please do keep an eye out for those. Creative Heart, as I mentioned, is an art therapy initiative that we are launching later this week, and it's an opportunity for, I suppose it's an opportunity. It's a kind of trigger for people to express themselves through their art about their experience with the Fontan, and then to share that expression through our social media platforms. So we would certainly encourage you to get involved in that launch when that happens later this week. Advocacy. ANZFAC, apart from just being a community that can connect people to each other and continue this conversation, this kind of sharing and supportive environment, we also have quite a lot of power when we band together to change things for the better. And we had a really, I think, inspiring talk right from the start of the day by Rachel, talking about what she's done as an advocate. Now, it's great if you can be an advocate for the person you care for, or for yourself, then that is terrific, and we would certainly encourage you to empower yourself as much as you can. But sometimes that can be really difficult when you're advocating as an individual, and banding together as a community can amplify your voice so much more. So we aim to do that and to provide an opportunity for people to identify issues that are common to people across the Fontan community, and then work out avenues to actually pursue advocacy and change. So that might be making people aware of issues, raising awareness amongst medical professionals and clinicians, amongst government or amongst the general public, making people aware about what a Fontan is, and then translating that into policy change. Some of those issues that we've identified as a committee already might be an increased emphasis on early intervention and I suppose interdisciplinary sort of conversations while kids going through a Fontan are in hospital. Better paediatric to adult transition services. There are a number of centres around the country where there isn't really an opportunity for kids to transition into adult care or into self-care, and it's about making professionals and policymakers aware of those gaps. Recognition of heart disease for pension purposes. So we had some discussion earlier in the day about the NDIS. At the moment, as many of you will know, Fontan and a lot of heart conditions aren't included in the NDIS, but there are circumstances we think where that ought to be considered, and go through a fair assessment process. So advocacy around those issues. Use of appropriate language and terminology. You will occasionally encounter things like, we had in the workshop that I was in just a moment ago, we heard some discussion about fairly insensitive conversations that go on around Fontan. So it's about making that a more sensitive environment for people living with Fontan circulation, and altering some terminology. Just general approaches to patient control, input and autonomy, and trying to enhance patient autonomy. We get a lot in these days, and you know, particularly in these days, but in many of your clinical encounters where there is an assumption that patients and their families are uncompromisingly empowered, I guess, and are able to articulate their wants very clearly, but that's not always easy. So ANZFAC provides an opportunity for us to point out where sometimes it's difficult for patients to exercise their autonomy on a particular issue, And the last point that we've identified there is connecting regional and metropolitan services. Many of you will know when you travel to a centre of expertise like Melbourne or Sydney, a lot of your information is sort of left behind in your kind of regional centre, or there isn't as much connectivity between those things as we would like to see. So advocacy is also about strengthening those connections inside the health system, so that patients can have a more fluid transition between healthcare centres. But those are just some of the issues that we've identified, and we're going through a process of translating those, identifying those issues into policy change. But really it's whatever is important to you, and it's important that we know what's important to you. So some of our paraphernalia out on the Heart Kids table this morning is some information about what we do and who we are and how you can get in touch with us. One of the other pieces of paper is a survey which gives you an opportunity to let us know what your priorities are, what your thoughts are about any one of these issues, whether it's one of the awareness, educational support campaigns that we're rolling out, or whether it's down that advocacy avenue of an issue that you think is really important, which is currently unaddressed. So that's how you reach us. But I don't know how much time we have, but if we've got time for some questions and comments from the audience, that might be good. Do it at the end. Yeah, cool. Terrific. So thanks very much, guys. That's ANZFAC, and please do look us up and like us on Facebook.